prefer Sydney or Miss Fox?
Sydney.
Sydney? Okay. Just gonna wash my hands. Provide for privacy. Is the room comfortable for you?
Yeah, it's good.
Okay, so you can just have a seat. I'm just gonna take a look at your wristband. Could you tell me your full name and your date of birth?
Sydney Was, 11/17/92.
Okay, I see you have the allergy band, allergic to penicillin. Any other allergies I should know about?
Nope.
All right, perfect. So when I came in the room, I'm just gonna observe her general appearance, see if she has any signs and symptoms of distress and if her body is symmetrical. So can you tell me where you are right now?
Hospital.
And do you know what year it is?
2017.
Perfect. So alert oriented times 3. I'm just going to take a look at your IV site. When I flush it, just let me know if there's any burning. Okay. It doesn't look like there's any redness or swelling. It doesn't look infiltrated and the tubing isn't kinked, so everything looks good there. So now what I'm going to do, I'm just going to explain everything, the head to toe assessment that we're going to be performing, and I'll go over everything as we go.
Okay.
So first I'm just going to assess and look at your scalp and your hair, look for any bumps, lesions, look at the color of her hair and the color of her scalp. Also, I'm going to look at her nails and her skin for any breakdown. Nails, I would look for the color and for the shape of the nails. Skin, you want to feel for temperature differences in the extremities. Also, look at the capillary refill in both hands and both feet. So, okay, less than 3. And less than 3. So cap refill is less than 3 in all areas. Next, I'm just going to look at the external ear, look for any drainage, color, any lesions on the ear, any swelling. Next, I would look at her eyes. Make sure her pupils are equal, round, and reactive to light and accommodation. So just go ahead and look at the light, Sydney. And just follow the pen for me. Okay, perfect. While I'm doing that, you would look for the color of her eyes. The sclera looks nice and white, and the membranes around the eyes look nice and pink. Next, I'll look at the nose. Look for the color of the nose and if there's any drainage. And there's no drainage to be noted. Next, you look inside of the mouth. Look at the color of the gums, if there's any bruising, bleeding, redness, anything of that nature. So can you smile for me? Okay, facial symmetry is intact. So next we're going to do the respiratory assessment. So if you could just turn around for me. I'm just going to lift the back of your shirt up. And I'm going to take a listen to your lungs. Now each time I move my stethoscope, just go ahead and take a deep breath, okay?
Okay.
So have you been having any trouble breathing or any chest pain?
No.
Okay. So as I'm doing this, I would just inspect for the use of any accessory muscles, which is not present, and just look at the overall work of breathing that she's doing. So now I'm just going to take a listen to the lungs from the apex to the base. Lung sound clear bilaterally. Okay. So then I would teach the patient how to use an incentive spirometer and then have her demonstrate back to me. So next I'm going to do the cardiac assessment. Okay. So what I'm going to do is I'm just going to feel for your carotid arteries in your neck, just one at a time, all right? And I'm going to say that's about 2+ for each. Also going to feel her radial pulses and her dorsalis pedis pulses. If you want to feel for if they're equal bilaterally. Okay, and they are. And then with the feet. Okay, strong, equal bilaterally. Okay, so next I would palpate the PMI, which is at the 5th intercostal space, the midclavicular line, and there are no lifts or heaves noted. So next I'm going to auscultate the carotids that I just did with my stethoscope. Okay, so no bruits were heard. That's like a swishing sound, okay? So now I'm going to listen to your heart sounds with both sides of my stethoscope. First, we're going to take a listen to there's 5 different spots. The first is the aortic, which is the 2nd intercostal space, right sternal border. Okay. Next is the pulmonic, which is the 2nd intercostal space, left sternal border. Okay. Next is Erb's point, which is the 3rd intercostal space, left sternal border. Next is the tricuspid, which is the 4th intercostal space, left sternal border. Okay, so next I would do the mitral valve, which is the 5th intercostal space, midclavicular line. Next, we're going to do, I'm going to assess your abdomen. So if you could just go ahead and lay down for me. Okay. So have you had any nausea, vomiting, or diarrhea lately? Okay, when was the last time you had a bowel movement?
This morning.
This morning? Okay, perfect. So now I'm just going to pull your shirt up to expose your abdomen, okay? So I would look at the size, shape, and the symmetry of her stomach and look for any abnormal pulsations. Next, I would auscultate her bowel sounds in all 4 quadrants with the diaphragm of my stethoscope. Next, I'm going to auscultate the aorta with the bell of the stethoscope and listen for any bruits. No bruits noted. Okay, so if I would auscultate each quadrant for 5 minutes if I did not hear any bowel sounds. So now I'm going to touch your abdomen. I'll use one hand and then I'll use 2, okay? Just let me know if it's too uncomfortable for you.
Okay.
You can go ahead and sit up for me. Thank you.
You're welcome.
Have you been urinating more frequently than usual?
No.
Okay. How often do you urinate a day?
5,
5 times?
maybe.
When was the last time you went to the bathroom?
Just before this.
Just before this?
Yeah.
Okay. And do you have any burning or pain when you urinate?
No.
Okay. So I would monitor the intake and outtake of this patient. Have you been experiencing any swelling, numbness, tingling in any of your arms or legs?
No.
Okay, so what I want you to do is just grab my hands and squeeze. Oh, squeeze tight, tight, tight. Okay, good. Strength is equal in both hands. So I'm gonna put my hands at the bottom of your feet and I just want you to push. Push, 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 push. Okay, all right, good. All right. So for that, we were just testing resistance and strength. So you have your call light right here. Do you know how to use it?
Yes.
You do? Okay, perfect. Make sure I put the bed down to the lowest position with the side rails up. Is there anything else I can do for you? Do you have any questions? Okay, so I'm just gonna wash my hands. You have a nice day, Miss Floss.
Thanks, you too.